channel, I have put together a little slideshow that took me forever to put together. But there was a viewer that had a question about CT fascia bones and how to reconstruct. So I'm going to do my best to explain this to y'all through this PowerPoint slide. I don't have all the nice tools and stuff, or not that I don't have it, I can't figure it out how to do the pencil and all that stuff, so this is the best that I could do. Okay, let's go. So CT imaging plays a crucial role in evaluating the fascia bones. There's a lot of injuries that goes on with the bones. There's with the face bones, right? It's your star asset of a person's body, and there's a lot of pieces of bones there. There's actually 14 facial bones. We're not going to go through it, this is not that video, but every view counts. And here I just want we're going to come back to this image later, so just going the overview of like the frontal view, the lateral view, which is a sagittal view, and then there's no well, the coronal would be like the coronal suture right here, so that means you would cut this down, right? So if this were to cut this way, that would be your coronal view, and then if you were to cut your image this way, whether it's the lateral sagittal view or the coronal view, if you cut it across there, you're going to get axial views. And then how do you get a sagittal? Well, you'll use this coronal view to get the coronal. So you'll use a coronal view to get a sagittal. So that's how you do the cuts. Where are we going with this? So we're just going to go through this. We're going to come back to this image later just to see how we get it. I hope you guys got that anatomical section down. Coronal to make sagittals. You use your coronal and sagittals to make axials. And then even on your axials, you can make coronals or sagittals, right? Hopefully you guys remember that. So let's move forward. If I can move forward. No. So, importance of reformatting. We reformat because we need better views of what bone that we're looking at, if there's any fractures, if there's any pathologies that we need to look into more details with. Remember, in CT you get a whole 3D view. It's just not the plain films of just the front or the side views of X-ray. So you get in-depth information. And we just went over axial, sagittals, and coronals, so it plays a part in getting more accurate information, especially because there's 14 bones just in your face alone. Your whole body, just that little face, you have 14 bones. So a lot of the bones are really small, and you just need to get in there, right? And with our face, we're breathing, we're eating, we're hearing, we're seeing, we're doing all these things. There's a lot of surgery that can happen. You know how people have sleep apnea, or just polyps and stuff in their nose, or other things that they may have to have surgery. So the CT and reformatting will help surgeons get to where they need to get and see what they need to see. So some of the things that you may see, I'm not going to have all of it, and I'm not going to go through all of these things, but when people order CTs for the face area, you'll have the CT of the face, the maxillofacial, sometimes that's what it's called. You'll have your sinuses, just your orbits, the mastoids, which is also the internal auditory canal. So these are things that you may see in an order. These are some of the signs and symptoms that they may have, and that's why they're ordering this stuff. Contrast. Do we use contrast for facial bones? Do we use contrast for sinuses, orbits? Yes, sometimes we do, not always. And normally it's not with and without, but some ear, nose, and throat doctors like to order it. Remember, in CT, you can change your algorithm from soft tissue to bone window. But what you're just gonna have to do with the doctor orders. You can also reassure and ask and confirm and be an advocate for your patients to ask if this is the correct order or not. But normally, if it's like a fracture and they come in and they got hit in the face or a ball hit them or they fell, it's normally for a fracture, so they don't need contrast. Normally, contrast studies are for like inflammation, a mass, infection. Those are the things, because anything with contrast highlights the soft tissue. So if it's anything with bones, like the TMJs, mainly with bones, all you need is the non-contrast. So all these have different collimations, different scanning. So for your orbits, of course, you're not going to scan down to your mandible, the bottom of the jaw. For your sinuses, you're pretty much just going to get the sinuses. So we'll kind of go over that a little bit, but not too much, okay? Okay, so positioning for CT facial area. You're going to be supine, so the patient may look like this with their head up and the head holder, head first to the CT scanner. The gantry, normally there's a head holder, but let's say they have like a mass or their face is really inflamed and swollen or something's happening and they can't be in the head holder. It's fine to just lay them flat here. Do what you can for your patient, and less pain is better, right? But let's say they are walkie-talkie, and normally people with faces, they come in, it's normally with their sinus stuff, so they're pretty much walkie-talkie, and they can move. So their head will be there. Sometimes you want to adjust where your orbital meatal line is perpendicular, but as long as you get it through, then you'll be fine. Some of the things to consider, not always, but this is something to consider. Your centering point. Now, this is specifically your horizontal line. So the horizontal line is this line and this line, right? So that's going to reference each other, even here. So you're going to start your 0 point on here. Every machine is different, so not everyone's 0 point is the same. Some people's 0 point is above orbits. Some people's 0 point is like under orbits. It just depends on what your machine does. But let's say we're doing a facial. I'm going to go with this machine. It's going to go under the mandible, right? So you're going to scan from, you're going to start with the horizontal line there. And then the mid-coronal line, you're going to do anterior to EAM. So that's the line that goes actually this way. Remember, your coronal line's here. So that line is going to be anterior of the EAM. So the EAM is this external acoustic meatus. So centering for a head is further back because you have all this space here, but you don't need the occipital for a facial. Your facial is more to the front, anterior, than posterior. So you're going to actually have that coronal line further up, which is more anterior. So here, so the EAM is here. You want to go forward a little bit. And I would kind of maybe go, oops, not that one. Oops. Go a little higher, because remember your nose is right there, and that's the soft tissue. You want to get the nose when you're doing a face. So somewhere right there is going to be anterior to the EAM, so that's where that other line's going to be. So you're going to have 3 lines when you do your centering point when you zero out your machine. So the one on the bottom, this one here. So there's the XYZ axis, right? And then the mid-sagittal line So when you look at them in the front, when you're hovering over their face, that other line, you can go to the back of the machine and check as well. So you're on top of their head and you look forward. This line should be straight down their head. This if you line everything up and do your centering point, you should have less, what do you call it? Less reformatting. But in a face, it's kind of different because everyone's maxillary sinus is different. So, but it's best to always do your zeroing point, centering point, very nice. So your mid-sagittal line is going to go through your glabella and acanthion. Your acanthions are here, glabellas right here. Down this line, this one's going to be on the side of this and anterior to the mid coronal line, and then the horizontal line will come here. Okay, so that's how that should look. Okay, so once you're done scanning and you get all your images, let's say you're going to reformat, or sometimes your machine already does it for you. So like I said, your face has really small bones, and sometimes you want to look at small fractures. And if you're looking at fractures, you want at least 1 millimeter slice thickness. I would do 1 millimeter, 1.5 millimeters, very thin. I think 1 millimeter is pretty cool. And of course, that provides higher spatial resolution, finer details, and that's why it's finer thickness. This, I guess, more of like the soft tissue and stuff can go up to 2 maybe. But yeah, for fractures, more than likely, slice thickness is 1. All right, so let's get into the reformatting section. So for your axial, so this is what you should obtain as an axial image. The axial is gonna, remember, cut through the head this way. Inferior to superior, right? Or superior to inferior, whatever your facility does. So see how this head, what you can do if your machine allows it, you're gonna rotate them to your right, the patient's left. Remember, this is their left side and it's our right side. You see how it's not straight? The eyeballs, you can see it's tilted more towards this side than this side. So I would tilt it more toward the right and make sure that it's symmetrical and lined properly. But that's the view that we're targeting, this cut right here, not this positioning. And if you position well in the beginning, you wouldn't have to reformat. So how do you get that how do you reformat on the machine if you need to do an axial? So you're going to grab your sagittal volume. This is a sagittal volume. You're going to grab your sagittal volume and you're going to follow either the hard palette. I don't have a view of the hard palette, but if not, you can follow right here. This is the maxillary sinus, and you can just get your box, go like this, and you're going to tilt it and line it so that it's with the line of the maxillary sinus or the hard palate. Some people just literally do it like normal. They'll just go up and down. Like they don't even tilt it or angle it or anything. They just do straight axials. But I like to go with anatomy if possible. So I'll go through it with, again, with the maxillary sinus there or the hard palate. And then you're gonna bring it all the way up. If it's the sinus alone, you're of course gonna get your frontal sinus, but you don't have to go all the way down to your jaw. You just have to come about the hard palate, because your sinus, your maxillary sinus, the most inferior sinus that you have, is not going to pass the hard palate of your teeth. And then you don't need this back piece. You're going to go through another image to your sphenoid, and that'll be the most posterior aspect. And then of course right here you would scroll through and make sure you're not cutting the nose. But if you're doing the whole face, then of course you'd get the whole maxillary, not maxillary, you'll get the whole mandible all the way down to the jaw. And if it's soft tissue, make sure you get all the soft tissue, all the double chin, all that stuff, and then top of the orbits. So, or top of the frontal sinus, depending on your facility, right? And that's what I would do. Again, every facility is different. You do what you gotta do. But that's how I would get the axial. Use my sagittal to get the axial. Okay. Let's see what's next. So, let me get this out. So here's another axial view that you can obtain from the view earlier. And here's what I'm talking about. So let's say that you have a sinus, right? You don't need all this stuff back here. This is irrelevant to the sinuses. Some people get it and they don't care, but some doctors, and I've worked with some radiologists who will have me omit everything back here. So all this stuff back here, they don't want to see it. They just want to go through the sphenoid sinuses. So they collimate up to here. And then, so let's see how this. So the collimation literally is, of course, the front of the nose. You'll get it here to here. And then they would cut this off. They don't want to see anything else. This would go all the way to the nose, right? And then this would just come to the back of the sphenoid sinuses. And then they would cut this off into the edge of the maxillary sinus. And you'll scroll down, you'll go through and make sure you're not cutting the maxillary sinuses. And that would be the sinuses. Make sure you get your frontal, all of the nose, maxillary, and that's how they would do it. But some people, they don't mind just getting this whole thing, and that's fine if that's what your radiologist is okay with. So just be aware of collimation, of what you're going to do. So when you do the mastoids are just back here, and there's like a whole little setup with that. That's a whole nother story, and I don't even know if I could properly explain it without a machine. But let's not get to that, right? Okay. What's next? Okay, so our coronal view. Now we're moving on to the coronal view. This is a view that we want to see, that front facing, anterior to posterior or posterior to anterior. And this is the maxillary sinuses that I was talking about. So, where am I going? Yeah, so that's that. So to obtain a coronal view, you want to use this axial view, because you can cut across this way. You can cut across this way to get your coronal, right? Or you can also cut across this way using a sagittal to get to your coronal. So these are the two views that I would use. However, what I would do is, everyone's sinus is different. I'll go through a sinus and so you see how this one, it goes through both. You want to use a maxillary to just kind of adjust it accordingly, like to make sure it's straight. And if you use a sagittal, instead of it being like straight like this, make sure that when you angle, like have an angle on it and follow that maxillary sinuses too, so that it actually goes straight through. So yeah, to get a coronal, you'll use the axial, line it up to that one, or line it up to here. that's how I would do it. And normally it's posterior to anterior. So you'll start from the back and go to the front. And if you use this side, then you'll go from the back to the front. And sometimes I reference it with a neck. You don't want you. This is useless information. You're not doing the back of the head. You just want to come like. You'll scroll through and you'll see where, again, your sinuses are. And you'll just go forward like that. All right. And lastly, you have your sagittal view. So this is a view that you want to obtain. And how do you get your sagittal view? Well, I actually use an axial. You use your axial to reformat to get a sagittal. So easy peasy. All you have to do is find your mid-sagittal line, that nasal bone septum thing right there, and you just literally go across like that. So let's say their head was tilted, then you would just line this with wherever that line is, and that's how you would do it. And oops, yeah, so if it was more tilted this way, then you would tilt it this way. If it's more tilted this way, then you'll tilt it this way. But yeah, line it up like that, and then you'll move it from whatever your facility does, either from right to left or left to right. Again, so this is where I was telling you about some radiologists, they don't want you to go beyond the maxillary sinuses if they're doing sinuses, and they'll want you to start your collimation from here and go to here instead of like getting all the soft tissue and going out. They just really like just that's it. Yeah, so it depends on your radiologist. But normally I like to go soft tissue to soft tissue just in case, you need to see something. Of course, if it's with contrast, you have to get the soft tissues, but if it's just for fractures, some of the doctors just like to go from there to there and really collimate and hone in. But yeah, that's how I kind of navigate through my axial, sagittals, and coronals, and hopefully that's some helpful, useful information. So thank you for listening, and hope to see you soon with more information. This was weird doing a PowerPoint like this. All right, subscribe, follow, whatever you guys do on here. Okay, take care, bye. Toodles noodles. Stay rad.